Welcome to Mental Health Monday. My name is Rachel, and this is where we talk all things mental health. We talk about tips, tricks, tools, and resources that are both spiritually and physically impactful for your life. Ooh, that is a mouthful. Today we are talking about something a little bit controversial, and I hate the fact that I have to even say that it's controversial, but it is, so you know what, just is what it is. You know what I mean? It's fine. Today we are talking about medication, but before I get into that, I want to tell you a little story. When I was little, I had something called childhood epilepsy. Epilepsy is essentially abnormal electrical activity in your brain that's just like rapid firing of neurons. And I was brought to the hospital and I was prescribed medication that helped with this abnormal electrical activity in my brain. Now, I grew out of that childhood epilepsy, but I had never once been made to feel shame or condemnation or guilt for taking that medication. And I can't imagine anybody saying to me, you should just try harder to, get your electrical activity to go back to normal. You should just, will the neurons to go to the right place. Like, it's crazy. But for some reason, we think that we can talk to somebody with depression like that. Or think we can talk to someone with bipolar like that. It just literally, it makes no sense. It's like telling somebody with diabetes, well, your pancreas should just make insulin better, okay? Part of the challenge is that mental illness is such a spectrum, and the treatment plan for one person is going to look radically different than the treatment plan for another person. But we need to understand that medication is not the enemy. If your doctor prescribes you medication, take it. Take it. There is no shame in medication. Now, medication for some mental health challenges is not first-line treatment, and sometimes it can be used as a chemical coping mechanism rather than us developing our own coping mechanisms. But if that's what you need in order to get to something like counseling or a first-line treatment, you take it. Some medications are not meant to be on long-term, so things such as Ativan. But if you need that in order to get you to the treatment that will be long-term, then take that medication. Whereas some other medications are designed to be on long-term and help you live a successful, fulfilling life. Again, one person's treatment plan is going to look radically different than another person's treatment plan. Medication is not first-line treatment, but it is not the enemy. We need to remove the shame and the condemnation and the guilt or whatever you have been made to feel for taking medication. There is no shame, and I believe that whether it's medical or miracle, it is all the handiwork of the Lord. God has given people wisdom and knowledge and science to develop these things that help people. I think that's a beautiful thing. And I think it's wrong to make people feel ashamed of themselves for taking something that helps correct something in their body. We would never make someone feel ashamed for having to take insulin. Or imagine if we made people who wear glasses feel shame for having an astigmatism. That would make no sense. But why do we do that with mental health issues? So today, all I want to say is if you are prescribed medication and you've been feeling shame or guilt over that, be released of that. There is no shame. Medication should come in partnership with other things like good nutrition and sleep and physical exercise, but it is not the enemy. Remember that coping skills are a learned practice, and sometimes we need something to help us with that, to develop these coping skills, that they aren't developed overnight. And you might not need to be on that medication your whole life, or maybe you do. Again, such a spectrum. But make sure you're doing this in collaboration with your doctor. I'm not going to talk long today. This is such a huge subject, but I just wanted to even just broach the conversation that there is no shame in taking medication. It is not first-line treatment, but it is also not the enemy. Well, I hope you have a great week. I hope this was impactful for your life, and I'll see you in 2 weeks for the next Mental Health Monday. Bye. Also, just have this random plant.